students, welcome. I'm so excited to be here with you today to share a little bit about my profession. My name is Dr. Amisha Singh. I am currently a faculty member at the University of Colorado School of Dental Medicine. I am a dentist and I've worked in dentistry since 2015 when I graduated. I am lucky enough to have learned that a big piece of who I am as an educator, so I've come back to the school, to the same school that educated me, so that I could now teach dental students how to be dental students. I love my job. I love what I do. I think dentistry is an incredible profession. If you're looking for stability, if you're looking to make enough money so that you are comfortable and your family is comfortable, if you're looking for amazing groups of people or engaging or making a difference, dentistry does all of these things, okay? This is a picture of me at my white coat ceremony with some of the people who mean the world to me. Here you'll see my husband in the middle and then my parents on either side of me. This quote, I take it to heart. Education then beyond all other origins of human or all other devices of human origin is the great equalizer of the conditions of men or women. The reason I love this is because I am a first generation student. My parents came here from India, came to the United States, Colorado from India when they were, before I was ever born. And so I was the first person in my family to be born here. I'm the first person in my family to graduate from high school, go to college, and get a doctoral degree, all three, okay? And so I know what it feels like to look around and be like, I don't know anybody else who's a dentist. I don't even know anybody else who's a doctor. I don't know who to ask all these questions to. My parents always told me that if I got a degree, if I went and studied really hard and got a degree, that it would change my life, right? And it would open up this door that I didn't even know existed and give me all this opportunity and all this stability. And I trusted them, and I'm really glad I did, because they're right. The second that I got this degree, it changed my entire life. It allowed me to be able to have a seat at tables that I didn't even know existed before. I think dentistry is an amazing profession, and I want to be able to share that with you and share the change in trajectory and life opportunities that was afforded to me because of the letters behind my name. So let's talk a little bit about dentistry. There's a lot of different things that dentistry can do, okay? So now if you're a little bit of a queasy person, you probably want to close your eyes or shield your eyes, fair warning, before I switch over to the next slide, okay? Dentistry, the degree that you get is Doctor of Dental Surgery, DDS, which is a surgical profession, right? I work with my hands all day, every day. I do surgery all day, every day. You may not think of operating on teeth as true operating, but think about it, right? When we're putting an injection in your mouth, we're inches away from very vital structures like your brain, right? So this is very important. Some of the things that we do in dentistry is we can make smiles that look like this, that have just really had a lot of things happen, to looking like this, right? I have the ability to take someone's smile from here to here and think about how much that would change their lives, right? Think about how this person has more access to jobs or career trajectory, how they present themselves when they're walking down the street, just the confidence we're able to give them. These are some of the magical, beautiful things about dentistry. Also, if you kind of like the gnarly surgical stuff, right? We put screws in people's skulls and they're called implants, and then we can put crowns on top of them and help people chew again. So people who have lost all of their teeth and aren't able to bite into corn on the cob or take a bite out of their apple anymore, we have the ability to get them back to eating those things and living that quality of life. And for those of you who are like, I kind of like the blood and the gore, there are different specialties out there. For example, this is an example of periosurgery where we will actually reflect people's gums all the way back so that I can see the bone in their skull, and then maybe we put some gum or some bone graft in there. So maybe this is bone that we've harvested from an animal like a cow, or harvested from a different part of your body, and we put it back in there to help it grow around these teeth and grow into different structures. So there's a lot of different things that you can do. And for those of you who have been averting your eyes this whole time because you don't want to talk about blood, guts, and gore, there's also a lot of other ways to practice in dentistry, right? For example, this is one of my friends right here, and he is very, very involved in what we call dental advocacy. So a huge part of what he does is meeting with governors and state legislators to talk to them about issues that are impacting healthcare and dentistry. And so this is him somewhere in Washington doing that work, right? A lot of people will integrate it into their life where they are going overseas and traveling and giving back this way. A lot of people do mission trips almost every year. And so there's a lot of different ways to practice this profession, okay? So what I'm going to ask you is a series of questions, and I want you to start thinking about who you are and where on this spectrum do you fall, okay? So instant gratification, what do I mean by that? Like if somebody came into my office and they had a problem, how important to you is it that you want to solve that problem right away, right? Some of you might like Legos. My children love Legos. They love Legos because they can put these pieces together, and at the end of an hour, 2 hours, 2 days, 2 weeks, whatever, however complicated that project is, they have something tangible to show for it, right? So if you're one of those people who loves to see results pretty immediately, dentistry is a really great profession for you, right? Because, so if you're kind of like this person, someone who is at this star, or below it, right, of somebody who just really likes to see things and predictably create results for people. Think about that photo that I showed you of that smile that had lots and lots of cavities on it, and then I could turn that person into having this other smile, and I can do it pretty fairly quickly, right? Something like that might take me less than 6 months to get that patient from one place to another. If you come in with dental pain and on a single tooth, it might take me less than an hour to get you out of pain and back to healthy, right? So if that's something that's important to you. Then there are these other professions that exist out there that, you know, it doesn't really matter to you. You are okay with the long run, right? And so maybe something like behavioral health or psychiatry or even family medicine is something that is important to you, because think about it. If somebody comes in with diabetes or heart disease, there's nothing that you can really do instantaneously that's going to get them back to health, right? That's a lot of different pieces of the puzzle that need to fall into place to get that person back to healthy, right? Also, are you a people person or not a people person, right? If you do not like being around people all day, every day, then dentistry is a little bit hard, right? Maybe you want to go into something like radiology where you don't even really have to be around patients. You can just review x-rays and practice medicine that way, right? But if you are in this category of this star and above, dentistry is really fantastic for you because we work with people all the time and it's a really fulfilling part of our job. In fact, we're probably one of the doctors that gets to spend most of our time with patients instead of doing other things, okay, like note taking and keeping. Do we like details, right? If details bore you, then you probably don't want a detail-oriented job. Dentistry is a very detail-oriented job. I tell my students all the time, millimeters are miles for us, right? So if you really love big picture, there are different ways to practice dentistry or practice medicine or go into healthcare that might fulfill you a little bit more. Now, I am a dentist who totally falls into this category right here. Most dentists really love details. I like details, good at them, but I really like thinking about the big picture. So I practice dentistry by being an educator, right? I came back and I teach dentistry now, and so I get to think about big picture fairly often, more often than I would if I was a clinical practitioner, okay? How many of you guys like change, right? Do you want everything to be slow and steady and you know, really the same thing every single day, or do you kind of like your day to look a little bit different every single day, right? Dentistry is really, really good for clinical dentistry. When I owned my own practice, it was really cool here. But some of the business ownership stuff put me up here, right? And as a educator, there's a lot of things that kind of, my day changes almost on a daily basis sometimes, right? So really understanding what pieces of this really speak to you and what fulfills you is really, really important, okay? The next thing I have is like tools of choice. Do you like to work with your hands or do you like to work with your mind? Now, the truth of it is that even though I work with my hands, I'm also really working with my mind, right? I need to know anatomy. I need to know how the rest of your body fits into your mouth and vice versa. And so I am always working with my mind. But if you like working with your hands, most surgical professions, including dentistry, are a really, really good fit for you. Okay, so just kind of think about where you are. And then the last thing that I'll talk to you about is this idea of the stage, the actors, and the audience. It's a metaphor that I created that helps people think about this. So often we go to our young people and I say, what do you want to be when you grow up, right? And we ask you to choose the stage. I want to go into dental medicine. I want to go into med school. I want to go into pharmacy. I want to go into law, right? And we're telling you to choose this stage. But I think even more important than the stage you're performing on is the role that you're playing, right? And there's so many different players on this stage, right? For me, I used to be a clinician, a full-time clinician, but now I am a teacher, and the practice that I do is through my students' hands. I used to be a business owner, and I really love that piece of this. I was a coach for my patients when I was educating them. Being a healer was a huge, important piece of my identity. I do a lot of research now, and I'm really interested in research. Who else do you want to be? Right? Do you want to be somebody who is a clinician working in a hospital, working in a private practice setting? Do you want to be a leader? Do you want to be the top of a team, or do you want to be someone who is kind of taking direction? Do you want to work as a part of a team, or do you like working kind of solo, right? Figuring out these things about you and then figuring out who you want to be on the stage is really important, because then you can intentionally choose the stage, right? So for example, I know that I'm a teacher. It's who I am at the core. I'm an educator, right? It's why I'm doing this talk. So for me, I found a lot of happiness in dental medicine, but there were probably some other stages out there where I could have equally or even more so been fulfilled, right? Did I have to go to dental school to be a teacher? Well, the other piece of this is I really lean into this idea of it takes the time to travel the miles, right? So what I mean by that is so often people are like, oh, if I had only known, then I could have done this a little bit faster and then gotten accepted into this college sooner, or if I had just done this a little differently, I wouldn't have wasted time with a gap year. I don't think any of that stuff is true, right? You have to experience all the things that you're experiencing right now to help you say, this is the right thing for me, this is the right stage for me, this is the right role for me, okay? And then the last piece of this is the audience, okay? So the audience, by what I mean by that, is who are you trying to serve, okay? You're gonna practice in this profession, or whichever profession you choose, for 10, 20, 30, 40 years, right? And if you don't think that you dedicating decades of your life will make a difference to a slew of people, or to an entire profession, or to a world, you're mistaken, right? If you do this with intention, the world is going to be a little bit different on the day that you retire than you found it, right? So this is an empty audience space. There's plenty of room in here for a lot of people. So I want you to start thinking about who sits in this audience. Who do you want to serve? Whose lives are going to be different as a result of you getting into whichever career you got into? Okay, I'll give you an example of one of the students that I mentor. Her name is Tamanna, and she went to pharmacy school. And I really loved her. I think she's an exceptional student. So I really wanted her to go into dental medicine. And so I talked to her, and I told her, like, why do you want to do this pharmacy thing? Come over to the dental side. It's so much better. And she has a brother who has a congenital condition that doesn't have a good solution for it, at least when it comes to pharmaceuticals, right? They don't have a medicine to help treat him. And so for her, a huge piece of her why was going into pharmacy school to do research to create a solution for people like her brother, right? So her audience, really the person who was sitting front and center was her brother, who she loved, and she had such conviction in why she was doing this. Right now, she is a student in pharmacy school. She's loving it. She's doing a great job. I'm incredibly proud of her, but I'm even more incredibly proud of her because she knew her why, and she centered her decisions about her career around the legacy that she wanted to create. So I just want to leave you with all of these thoughts, and I look forward to the next piece of your journey.